Do you suffer from frequent heartburn, acidity, or that uncomfortable burning sensation after eating? Or maybe you've been prescribed a medicine called Omeprazole, Prilosec, 20 mg, but aren't sure what it really does, how to take it, and whether it's safe for you. In today's video, I'll explain everything you need to know about Omeprazole, Prilosec, 20 mg, its uses, dosage, side effects, safety in pregnancy and breastfeeding, and important precautions. By the end of this video, you'll have a clear and complete understanding of this commonly prescribed medicine. So let's get started. What is Omeprazole, Prilosec, 20 mg? Omeprazole, Prilosec, 20 mg belongs to a group of medicines called proton pump inhibitors, or PPIs for short. These medicines work inside the stomach by blocking the final step of acid production. In simple words, Omeprazole reduces the amount of acid your stomach makes. Why is this important? Too much stomach acid can cause heartburn, acid reflux, ulcers, and long-term damage to the food pipe. By reducing acid, Omeprazole, Prilosec, 20 mg allows the stomach and esophagus to heal and also prevents further damage. Uses of Omeprazole, Prilosec, 20 mg. Doctors prescribe Omeprazole, Prilosec, 20 mg for several conditions, such as GERD or acid reflux to relieve heartburn, sour taste in the mouth, and regurgitation. Erosive esophagitis helps heal irritation and damage caused by acid. Stomach and duodenal ulcers treats ulcers and prevents them from coming back. H. pylori infection used with antibiotics to kill the bacteria that cause ulcers. Zollinger-Ellison syndrome, a rare condition where the stomach produces too much acid due to tumors. NSAID-induced ulcers prevents ulcers in people who must regularly take painkillers like ibuprofen or aspirin. So whether it's occasional acidity, chronic reflux, or more serious stomach conditions, Omeprazole often plays a key role. Dosage and how to take Omeprazole, Prilosec, 20 mg. The typical adult dose is 20 mg once daily before meals, usually in the morning. For severe cases, the doctor may increase the dose to 40 mg. GERD 20 mg daily for 2 to 4 weeks, sometimes extended to 8 weeks. Ulcers 20 mg daily for 4 to 8 weeks. H. pylori infection 20 mg twice daily with antibiotics for 1 to 2 weeks. Zollinger-Ellison starting dose 60 mg daily, adjusted as need. Take it on an empty stomach, before meals. Swallow the capsule/tablet whole with water. Do not crush or chew. If you miss a dose, take it when you remember, but skip if it's almost time for the next one. Do not stop suddenly without medical advice. What are the effects Omeprazole, Prilosec, 20 mg? Most people tolerate Omeprazole well, but like all medicines, it can cause side effects. 1. Common, mild. 2. Headache. 3. Nausea or vomiting. 4. Diarrhea or constipation. 5. Gas and stomach pain. 6. Less common but important. 7. Vitamin B12 deficiency if used for more than a year. 8. Low magnesium, leading to muscle cramps, irregular heartbeat, or weakness. 9. Increased risk of bone fractures with long-term use. 1. Rare kidney problems or severe allergic reactions. If you experience severe symptoms like rash, difficulty breathing, or chest pain, seek medical help immediately. Can we use in pregnancy? Omeprazole is generally considered safe in pregnancy. Studies have not shown harmful effects on the baby, but doctors recommend using the lowest effective dose and only if clearly necessary. For mild heartburn, doctors may suggest lifestyle changes or antacids first. But for women with severe reflux or ulcers, Rujole is often prescribed safely. Can we use in breastfeeding? Omeprazole, Prilosec, 20 mg passes into breast milk in very small amounts. Research shows it is safe for breastfeeding mothers and no harmful effects have been reported in infants. Still, always consult your doctor before taking it while nursing. Precautions and interactions. Before taking Omeprazole, Prilosec, 20 mg, tell your doctor if you have liver disease or osteoporosis, have low magnesium or vitamin B12 levels, are taking medicines like clopidogrel, warfarin, digoxin, antifungals, or certain antivirals, as interactions may occur. Also, remember lifestyle changes can make a big difference. Avoid spicy foods, alcohol, smoking, and late-night heavy meals. So, Omeprazole, Prilosec, 20 mg is more than just a heartburn pill. It's a powerful medicine that heals ulcers, prevents complications, and improves quality of life when used correctly. But remember, it should never replace professional medical advice. If this video helped you, give it a like, share it with anyone struggling with acidity, and don't forget to subscribe for more doctor-explained health videos. Stay healthy, stay informed, and I'll see you in the next video. This video is for educational purposes only. Always consult your doctor or pharmacist before starting, changing, or stopping any medicine. Thanks for watching. See you again next time.